Hello all, this is Dr. Shilpi Reddy and I am going to talk about female sexual dysfunction. A very less discussed topic, but then yes, female sexual dysfunction is one of the most important reason for women's well-being and happiness, and about their life, their rights and their capacity to go forward for a confident living. And when you talk about sexual dysfunction, what is actual female sexual dysfunction? When there are persistent and recurring problems in, you can say, sexual response, desire, orgasm and pain, these kind of problems which are very persistent and regular and are impairing quality of life in women can be a cause of lot of distress, and they can strain your relationships in fact. So this is sexual dysfunction in females, which is also called as FSD. FSD, when we discuss, there are a lot of issues with the woman, there are issues with the partner, and that, as I have told you, can cause a distress and a strained relationship. And it can be in one phase of life or one part of life, or it can be a continuous problem in the woman's life. So FSD can be episodic, can be sporadic, or can be a very continuous problem. When we have to talk about female sexual dysfunction, it can actually occur in any stage of life, any phase of life. But very importantly, they occur in certain sexual situations, and they cause a lot of problems during particular phases of life, like say pregnancy, post-pregnancy, when there is additional responsibility of the child, and especially in situations like fertility and fertility treatments. There are issues again with sexual identities and sexual pressures and timings of intercourse and all that. There can be FSD at that time also. And when we have to talk about sexual response, it is a very complex phenomena. And FSD, it can be a combination of physiological conditions that we encounter in life, and it is a combination of emotions, it's a combination of experiences, what women go through, combination of beliefs, lifestyles, and a lot of relationship aspects also come into FSD. So when sexual response is interdependent upon so many complex phenomena, especially the physiological aspect that happens in women, so any disruptions to either physiological aspects of life, or emotions, or experiences, or beliefs, or lifestyles, or any relationship hassles that they all have a very huge impact on FSD. And any disruptions in these fields can be one of the major organic causes of FSD, and which actually affect the sexual desire, they affect the sexual arousal, they affect the sexual satisfaction, causing lot of problems in FSD and relationship issues. So FSD per se is this complex, and when we are dealing with this complex problem, every step that we take to deal with these problems is very important and very special, and identification of problems in these aspects is very, very important. That's about female sexual dysfunction called as FSD.